That's really what's going to hit home. Oh, I can see why you want this. Ask Dr. Gray Pre-Med Q&A brought to you by Blueprint MCAT. How are you doing today?
Good, thank you.
What can I help you with?
My original question, so right now I'm a nurse practitioner.
Okay.
And I've been a nurse for 10 years and a nurse practitioner for 3 years.
Awesome.
Okay? And so I've always wanted to be a physician. But listening to all of your podcasts and pretty much how do I get started? Okay, that was my big thing. Because I listened to a lot of your things, and so a lot of it, when I listen to the PAs and the nurse practitioners, they're like, okay, well, they want more knowledge. But it's like, well, I can pick up a book and get more knowledge. Well, there's my knowledge there, but there's more to it.
Yep.
And so when I think about it, my big thing was creating my personal statement, because everything that I think about resorts back to what I just said, picking up a book and getting more knowledge. But there's more to that, I think it's just finding that. Because right now I have a family. I have 2 boys. This is my town, my support system. So I don't have that flexibility to just pick up and leave and go somewhere.
Yeah.
So if I do everything, I want to try and do everything right the first time. So that way my chances of getting accepted to somewhere close to home are high.
Got it.
If that makes sense.
It makes a lot of sense. So super mom out there working as an NP. How old are the kids?
3 and 7.
Okay. So, very similar to my kids. I have an 8-year-old and an almost 4-year-old. And so they're no picnic, taking care of kids and working as an NP. What's your FTE as an NP right now? Like how much are you working right now as an NP?
Oh gosh,
full time?
Yeah, full time.
Yeah.
More
Wow.
than that.
Okay. So you're doing it. You're doing it all. Now the question, I'm not really sure what the question is. Is the question just, what do you do next? Is the question, how do you write about why you want to do this?
My question is, because when you ask me, okay, why do you want to be a physician?
Yeah.
Okay, that, I guess it's just finding that in the right terms. Okay. Because yes, I want to know more. It's the knowledge.
So let me ask you, stop right now. Why do you want to be a doctor?
I love my patients, and they are just everything. You get that good relationship with them, but I feel like I'm limited myself, and I want to be able to give them more.
Okay.
In that aspect.
Okay.
I want to fight for them more. Yes, I can be an advocate as a nurse now, but more to that,
Okay. That makes sense. So stop right there. So why do you think that's not good enough?
I don't know.
Okay.
I don't know.
Okay. Do you have a specific patient in mind when you think about this? A patient where you couldn't do what the patient needed because you're quote unquote just an NP?
I think it's more of the knowledge, like just them asking in-depth questions. And
no, I understand that. Can you think of one specific patient right now?
Going back to my previous specialty, I did vascular.
Okay.
And so I evaluate them. If they meet the criteria for an angiogram, then I'd send them through.
Okay.
So we'd get the ones that there's always pushback from the insurance for some reason. And it just kind of like sometimes the line just stops there and you wish you could do more. Well, some physicians don't do pro bono. And I guess it's more or less in that aspect of wanting to help them out. Like, well, if I was a vascular surgeon, I could have done this in particular for them.
Yeah.
Instead of just having the line stop there or just turfing them off somewhere else.
Okay. So as you think about your journey, as you do that deep soul searching and self-reflection, finding those specific stories are really what's going to connect to the reader of your personal statement, the interviewer during your medical school interviews. That's really what's going to hit home. oh, I can see why you want this. And it's going to motivate you as well, because then it's going to confirm for you, like, I need to do this, because there are going to be steps along this journey where you're like, why am I doing this? I have 2 kids. I'm an MP. I'm living the life. I'm taking care of patients. Why do I keep saying I want to be a doctor? And then you think about these patients, you go, oh, yeah, like, I don't want to have any more of those patients in the future, when I can continue to say to myself, oh man, if only I were a doctor, right? So you really need to do that soul searching right now as you're going through this process, ramping up whatever you need to do to get ready to apply to medical school. That's really going to keep you motivated and really solidify for a reviewer, interviewer, etc., why it is that you want to go from being an NP to being a physician.
Okay.
Does that make sense?
I think, yeah, it does. And I mean, there's a lot of patient experiences that I have, and it's just, I guess, just putting it all together, to where it doesn't just sound like the whole thing is because I want more knowledge and I love people,
Exactly.
more to that.
100%. Right. And I say that all the time. It sounds like you know that, of like, again, knowledge, like go on to Wikipedia. You can learn more knowledge. What are you going to do with that knowledge is what I really want you to focus on. And then if you can reflect back on patients to show, like, if Sally were my patient in the future as a physician, I would be able to do X, Y, and Z. And it's somebody who I think about all the time as I think about this journey of why I'm doing this.
Okay. That helps. It helps. It's just, thinking about it and just finding the right thing. That was my biggest struggle. Because I think about it because I'm just like, okay, I pretty much have everything set.
Yeah.
Have my family. I already have my career. I'm already working, But I just feel like I just need a little bit more.
Yeah. So let's rewind. I'm gonna turn this into a little bit of an interview with you. Is before you went down this path, you became a nurse and then an MP. Did you ever want to be a physician before, and then you just didn't do it for one reason or another?
I just honestly never thought that I could, or just had the knowledge to do it, or I don't know. Ever since high school, I've always wanted to be a nurse. Always wanted to be a nurse. And at that point, I didn't know nurse practitioner was a thing. And so went that route. But now it's to the point where it's like, do I want to go back for my doctorate in nursing or just go straight to medical school? Because for me, I feel like if I go DNP route, what am I going to do with that? It's the same thing. It's the same thing.
It's not a clinical doctorate, so.
No.
Yeah.
No. I mean, if anything, I can teach, and I love to teach, but that's not.
It's not impacting the patients with that.
It would be wasted time if I did that.
Yeah.
So.
Yeah, and that's good, right? The fact that you're being intentional about this process, you're asking the questions, you're figuring out what it is that you want. That's all of the right things. And maybe at some point you get to a point where you're like, oh yeah, I don't actually want to go to medical school. I can do X, Y, or Z, and that's okay too. You're asking yourself the right questions. And I think as long as you understand that, and it sounds like you do, that it's not just the knowledge that you need to go to medical school for, it's the impact that diploma really and the credentials that the clinic and hospital are going to give you that allows you to do more with those patients. And whether it's being in the operating room or having peer-to-peers with the insurance company and being able to advocate more for them, whatever that is, it sounds like you're thinking about all of the right things.
Okay, good. Good, that's good. That gives me hope.
Yeah. So you're an NP now. You're practicing. 2 kids. We talked about that. And it sounds like support-wise, you're going to be pretty limited with where you can apply. So hopefully you're in an area where there's some schools for you. What is the process for you? Like, are you very early on in this process and you have to go take some prereqs and take the MCAT, or
I have to do all of that.
Okay.
I have to do all of that. But I was just to the point where, do I want to go that route? First. And so my plan was to do all the prereqs first. But that was another one of my questions, because I keep hearing about community college and then going to university for your prereqs. And,
Yep.
and I hear mix. And
Yep.
so I don't really know if there's a difference or if if they look down on that or what, you know?
Yeah.
But for me, it's easier to just go to community college just because of the flexibility,
Yep.
you know, evening courses, I can still work, things like that.
Yeah. So that's the answer. So the historically, there has been a stigma against community college. That stigma is going away more and more and more and more. There will be some medical schools out there that will be like, why are you taking all of your prereqs at community college? And then they'll look at your job and your activities and go, oh, you're working as an MP. That's probably why you're taking college or classes at community college. I think it's well known that community college is much more flexible, especially for non-traditional students. So I wouldn't worry about it at all.
Okay.
With the one caveat, if you are limited with where you're going to apply to medical school, maybe you're limited with just where you're going to go right now for your undergraduate classes and you're more open to travel for medical school, then this is less of an issue. But if you're limited with where you're going to go for medical school, I would start having those conversations with the medical schools that you are local to and the ones that you're going to apply to say, hey, I just want to reach out. I'm working as an MP. I have 2 kids. I want to go to medical school. I want to go to your school. Like, this is where my community is, my support system, etc. This is my plan, right? I'm going to take these classes at community college. I'm going to take the MCAT this time, and I'm going to apply to medical school. What do you think? And get their buy-in and start that conversation.
There's only one here in San Antonio, so I just got this one shot.
Got one shot. UTSA. You got it. The DO school is down in San Antonio too, isn't it?
Oh, you know what? I lied. There is that one too. There's that one. There's UTSA and then the Incarnate Word, the DO.
Yeah.
So there's those 2.
Yeah, you get 2. Where's Tyler compared to you, the new UT Tyler school?
I think it's pretty far.
Yeah, okay. Yeah.
There's that one and there's the Rio Grande one.
That's far.
Yeah.
Yeah.
So,
Austin's not too far from you.
No, it's maybe
hour and a half, hour 45.
away.
Yeah, depending on traffic.
Yeah, those are just my biggest one is San Antonio, just to, you know, it's the patient population. I know I don't plan to move elsewhere to practice, but it's
you just like
easier.
the Riverwalk too much.
Oh yeah, I go there every weekend.
Okay, so yeah, reach out to UTSA and start having conversations with them, and just don't be overly aggressive. Just try to understand that they're busy and you just want to touch base and just say, hey, I'm a future applicant and here are my thoughts.
I'll do that then. And then just start my prereqs and then just study really good for my MCAT and then just apply. And so that was just
piece of cake. That's all it is.
cake.
Yeah, that's awesome.
Yeah.
That's exciting.
Yeah, but that was my only big thing is just, just really figuring out, I guess, what route to take. And I really want to further my education, do more, but it's just, DNP, MD, DNP, and I read just a lot of different things about it. And I don't honestly think that I'll be satisfied if I did my DNP.
Yeah, and just from listening to you for these 13 minutes or so, and what little I know about DNP, you probably know a lot more than I do, is that just it's not a clinical doctorate. You're there to learn whatever you're learning. It's more of a progression of career and not necessarily more impact to patients.
Right.
And so if that's what you want, right, if you want to go be faculty and teach and do whatever, then potentially that's the better option. But from what you're saying so far, it sounds like you want more impact on a patient level and not necessarily kind of faculty career level. Obviously, a physician is a different career path, but offers up a lot more opportunity for you as well.
Yeah, and I'm not talking bad about it because I know how you always say not to talk bad about it, about your previous profession, because I love being a nurse, but it's just like I said, I just need a little more. Need a little more think to make me happy.
It's understandable. So go out there and get it done.
I'm gonna try. I'm gonna try my best.
Piece of cake. Yoda says there is
But
no try. Do or do not.
right, exactly. And then I was like, well, am I too old to do it?
Heck no.
I'm 32. I'll be 33, and so I say, I figured 10 years I'll get it done. But it's like, well, 10 years is gonna come either way. So
Either way, go out there. Very recently on the Pre-Med Years podcast, I've had multiple 50-year-olds on, so that are in medical school. So just go out there and do it.
yeah, I figure if they can do it, then I can do it.
Show your kids. Yeah. Show them how it's done. Okay.
Well, good.
Any other questions?
No, that was my biggest one. Biggest one, and talking to you helped a lot.
Good. Well, good luck to you. Be rooting for you.